Time for another COVID-19 update from the city of Reidsville. Reidsville Mayor Dr. Donecker is with us by telephone. We're doing our weekly updates with the mayor by telephone, and that's because we're doing our social distancing. If you've ever been in our studios here in Reidsville, you know we're kind of in cramped quarters, and so to keep us safe and to keep our guests safe, we're doing that for the time being. That's the way we're doing things for the next little while. So, but the information is good, whether it comes to you by telephone or by camera. And Dr. Donecker is on the line to give us an update on what's going on. And Mayor, thank you so much for being on the air with us again. I think this is our third week, I believe, of bringing information to our viewers.
It is. And thanks for having me on the show again this week.
We had an update from you on Sunday where you have been bringing us these. You've been doing those actually longer than you've been appearing on the air. You've been bringing the people by the Code Red system. You call people on their home phone, cell phone, by email, and you give an update every week with what's going on. How's that working out? Are you getting a good response out of that?
Well, I guess no response is good response. I haven't heard any complaints yet.
Right. That's good.
So, that's right. What we're trying to do is make it as unobtrusive as possible, but just, this whole COVID-19 situation is very fluid, and there are a lot of changes, and, people get whispering and rumors go flying around. We just want people to know that Sunday night they're going to get a little message from me on their voicemail if they don't pick up. And it's just to bring them up to date with where we are with the COVID-19 here in Reidsville.
And that's what we're doing here today for our viewers that may not have Code Red. We encourage you to do that, and you can sign up for those Code Red alerts by going to the city's website and looking for the Code Red link, and it's very easy. You just put some basic information in there, including your telephone number. You can choose to get a text message, an email, a phone call, so it's very easy to work. But Mayor, let's go ahead and update our viewers on what's going on, and I think you had some reminders from the city that you wanted to bring to our viewers.
Sure, and the nice thing about your show is we can go into a little bit more depth than what I can in a 2.5-minute message on Sunday night. So what's happened since last Wednesday is that the governor signed Executive Order number 131. And different than the other initial order, 121, in which he said, this is our stay-at-home order for the state, and any municipality wants to be stricter would not be superseded. This order announced at 4 o'clock Thursday afternoon. Basically, order number 131 says differently. It says that these are the determinations of what the maximum occupancy is, and it supersedes or overrules any stay-at-home orders in municipalities and counties that are more strict than what this order is. Mm-hmm. So, and what that means for Reidsville is our calculations, just to use the Walmart as an example, our calculations said that only 450 people could be present in Walmart at one time, including their employees. With the governor's stay-at-home order, up to 1,000 people can be in Walmart at one time, including their employees.
Right.
But for consistency, he just said that across the board. Now, he also has said that if at any point that Walmart thinks they're going to, or a large store, any store, is going to exceed the number that they have determined, which is 5 customers per 1,000 square feet, they have to have staff posted at the entry and exits to make sure that the limit is not exceeded.
Now, I'm going to, and let me add that I had to make a trip on Friday of last week, and then I had to make one yesterday, and I had to go into a business. I go to do what I have to do, and then I have to leave, and I've got to tell you that at both of the businesses located in the city of Reidsville, there were people counting others at the door, customers at the door. So I think I think people are really doing what they're doing. I've noticed more of that in the last week especially.
Yes, and what the governor's order has done, which is a good thing, is put a consistency across the whole state in what is to be expected. The only downside is that the big box stores can have actually more people in there than really, if you want to stop the spread of viruses, you really shouldn't be able to have 1,000 people in one spot. But anyway, that is what it is. You can't always do something simply and have it suit all the different situations. I would recommend that anybody who is in the vulnerable population, 65 and older, or people that have heart, breathing, kidney problems, diabetics, should shy away from going to the big box stores unless they want to go early in the morning when they have hours established on specific days for the vulnerable population to go inside, because the big box stores and all stores are to be cleaned and disinfected at night so that the lowest viral load to infect a vulnerable person will be first thing in the morning.
I got you. Now let's talk about these social distancing markings. I've noticed that too. Noticed that the floors are marked where customers can stand, and so this is a great way to let people know, because there are people who, as we well know, can't always measure the person for height, or they're not very good at guessing weights and things like that. So with these markings on the floor, it's pretty hard not to know exactly where you should be standing when you're in a business, right?
Absolutely. In fact, I had to get a battery at the auto store on Scales right across from McDonald's, and they had things well marked. They actually had a plexiglass for the person behind. They had they had a table in front, so they made you 6 feet away from where the person is behind the cash register. They had the slide slot for your credit card. They had taken all the things that were necessary, and they had a number posted about how many people could come into the business at one time. Mm-hmm. So yes, most businesses are stepping up to the plate, because it's not just for the customers to keep from getting infected. They don't want their employees to get sick. And we don't want the employees to get sick with this virus. This virus is a lot more infectious than what people are used to dealing with, such as routine influenza that we deal with.
Now, they've also marked the floors. You see the floors, and I can see, for instance, and I've got to give a big shout out to Lowe's Foods on Freeway Drive in Reidsville, because I've noticed that they really have the floors marked well, even when you're at the deli counter. For instance, if you wanted to pick up some of that fantastic grape chicken salad that they have there, not that not that I would give it a free plug, but I'm just saying. So you're there, you're there, and you're picking up some chicken grape salad. They even have a point where it says, "Please stand here," where they want you to stand. So they give you, so they're clearly telling you how far to stand away from the counter, and that's for your protection, and I'm assuming the protection of, well, I know, it's the protection of the employee that's there.
Right, and the other thing that you should look for when you go into a grocery store is look for markings on the floor telling you what direction to go down the aisle.
Yeah.
That way you don't have to pass close to another person as you're going down the aisle.
I noticed that too, and I also noticed some people, and I did have to chuckle a little bit, because there are people that are confused by this. You know, this is so new to all of us, and this is something that we've never all had to do, because usually you can go down an aisle and you see somebody and you talk to them and you say hey, and you catch up for just a few minutes. But now these markings are telling you exactly where you need to be, which aisle you need to go, and even some big red stop signs put on the floor to say stop, do not enter, please go around, and that's to keep everybody going in the same direction.
It is making a difference. We do have a low infection rate here in the county, as determined by the test, but please remember, our tests are only for people who are very sick and in the process of being hospitalized. Mm-hmm. So anybody that has a high fever or has the sniffles or a cough but isn't to the point where they have to be hospitalized, a test is unable to be obtained for that person. So we have low numbers, 15 or 16 now, but most likely you could multiply that number by 10 or 20 because for somebody as severe as that, there's usually at least another 10 or 20 that are less severe, spreading the virus around.
I think our next slide gives us an idea of something else that's helping to combat this whole situation, and that's that businesses shall perform frequent and routine cleaning and disinfection of high-touch areas. And here's another shout out to Lowe's Foods. I know that last week you talked about Food Lion on Way Street and how they were doing it
on Way Street, yep.
And so Lowe's Foods, I go into Lowe's Foods last Friday. There's a young man who's in there cleaning the carts, cleaning all of the surfaces. They had carts that had been used over in one part of their vestibule. Then this young man is cleaning the carts and putting those out. Young lady standing there counting people as they come in and out of the store. So this is another example of that. But this frequent cleaning and disinfection is very important, and I think that people are getting this because I've seen that in several locations.
Yes, and it should be readily available, and for people coming in, plus the store and the employees cleaning it as well. And that's also why at the beginning of the day, that's when the vulnerable population should go to get their groceries, because the viral count, or the load, as you would say, is much lower in a building that's been empty for a number of hours and has been disinfected.
Mm-hmm. Okay, so now let's talk about more. We'll talk about the other requirements for retail businesses, and I think we've got another slide there. Anything you want to add to this, Mayor?
Basically what I said earlier, that when the Governor's Executive Order 121 came out, we felt the need that we needed to be a little bit more explicit. Now that 131 has been announced 4 o'clock on Thursday and is in place starting Monday at 5 o'clock, basically it preempts what we've already said. I do want to say that I've heard a number of people say that Reidsville has a lockdown policy. Let me tell you, we are not in a lockdown mode. A lockdown mode would be that there are no businesses open, everybody has to stay at home, anybody on the streets has to have some kind of acknowledged reason for being on the street. We are nowhere near that. We basically have a stay-at-home policy like the governor's articulated, and in which people who are participating in essential businesses can stay open, and people who want to go to those essential businesses to buy things can go. So it is impacting our economy, but anybody who says that what we're doing is a lockdown, it's a misnomer, and in some ways trying to fan the flames of discontent. This is a necessary thing to keep our infection rate low so that we don't overwhelm our hospital. It's working, and it's just like a vaccine. When it's working, you can't tell it's working because it's preventing the problem that you're doing this behavior for.
Right.
That's a good thing.
Now, do you see this changing anytime soon? I know there's been some talk about the governors, some governors around the country maybe thinking about starting to loosen up some of the policies, some of their executive orders. Do you see that happening anytime soon?
Well, it would have to come from the governor, because this order that went into effect on Monday is supposed to remain in effect for 30 days. So that takes us through the middle of May.
Right.
I think that people who think that we could all of a sudden open up retail businesses and we get back to normal and we live happily ever after are in a dream world. We don't have enough testing to actually determine how to mitigate the infections that we're dealing with. We need even more testing to start tracing and figuring out who has the infection and needs to be self-quarantined in their house, who else has interacted with that person in the previous 2 weeks to also self-quarantine, much like what the employee up in Ruger that turned up positive, and then they had to let other people that were associated with that person for the previous 2 weeks to self-quarantine.
Right.
And for that, we need a lot more testing. And you will know when we have a lot more testing when you start hearing, oh, there's going to be a site where you can drive by and be tested, like what they did on Wendover and Greensboro for, I want to say, for about a week.
Right.
But until we have enough protective equipment for the people doing the testing, and until we have enough test reagents, test swabs, and testing kits, we're not going to be there yet. So my sense is we're going to stay in this condition probably for the next 30 days, at least.
Now, I know that you, Cindy Farrand, who is president of Annie Penn Hospital, I know that she spoke with council on Monday, and I think she gave some numbers and different things. We'll try to get through some of these if we can, and give you a chance to talk about Cindy's comments to the council and kind of an update on what's going on with Annie Penn Hospital in this COVID-19 situation.
Yes. In fact, one of the slides that she presented is where we were. It's the one from Cone Health that says then, and it showed that we were going to have an overloaded hospital between the 18th and 23rd of April, or we had to at least do shelter in place.
Right.
And that was implemented successfully. And the next slide shows how now we've actually delayed that need or that risk of having our hospital overloaded. And I know that people will say, well, we haven't had the infection at Annie Penn. It's a zero. It's a goose egg. Why are we even doing this? Please remember that the severe cases of patients that by telephone they can tell that they're severe or that they're in significant breathing difficulties, they're being told to go to Wesley Long because they don't want to have a positive COVID at Annie Penn as much as possible. We want to take all the chances we can. So our stay-at-home is working. One of the things that you heard me say a couple weeks ago is when we do stay at home, we're flattening the curve, but at the same time, we're extending the duration of the risk of having a little bit of a surge to overwhelm our hospitals. So this is something that we really need to persist if we really want to make it work.
And I know that Cone Health was so concerned about this that in addition to Wesley Long Hospital, the former women's hospital located in Greensboro, which they moved, for those of you that don't know, they moved the women who are giving birth there to Moses Cone. They actually built another wing there for the expectant mothers and for the delivery of babies. So they still have this hospital facility, which was Women's Hospital. They actually converted it to be able to handle COVID-19 patients. Right, Mayor?
That's exactly right. And that's because this is going to continue. There are more cases going up or increasing in Guilford and Forsyth and Alamance. And Rockingham County, if you look at slide number 8, it shows Piedmont Triad as of April 13th. And they have Rockingham County as 14. I think now we're 15 or 16 with 2 deaths. That is very underrepresented of the number of people who are carrying the infection here in our county. Mm-hmm. We have thousands of people who go to Guilford County to still work. So they're going into an area that already has quite a number of people infected. But again, the number in Guilford is underrepresented because these are the number of people who are so sick they needed to be or were going to be hospitalized. And there are a lot of people walking around who either don't know they have the infection or they're coughing, they're sneezing, and they say, oh, it's just allergies. Could very well be COVID-19. And to them, it's not doing much. But to an older member, their father, their mother, aunt, uncle, grandmother, it could be fatal.
Right.
And so that's what we're trying to avoid.
You've got 1 minute, so I'm going to give you the last word, Mayor. What advice do you have for our viewers here? Not only the citizens of Reidsville and the businesses here in Reidsville, but for all of our viewers, what would you have to say to them?
Well, first, I would like to thank everybody for as a population really adhering to the stay-at-home. It is making a difference. I also would like to say that we're in this all together. This is not fun. It is putting a stress on our families. It's putting a stress on our pocketbooks. But we're going to get through this. And when we get through it, we will be much healthier, and we'll have more people around that if we did not do these stay-at-home orders, they would be not with us. So hang in there. Let's keep it up. And I look forward to seeing the number for Rockingham County kept in the low double digits.
All right, and we will
thank you, everybody, for your efforts.
We'll be catching up with you next week, next Wednesday at about 5:30, 5:35. We'll catch up with you and find out what's going on with the latest. And, of course, people on Code Red can expect your call on Sunday, right?
That's exactly right.
Thank you, Mayor. Appreciate your time. Appreciate you updating us on what's going on.
Yes, sir. Thank you.
All right. Reidsville Mayor Dr. Jay Donecker bringing us his weekly update on what's going on with COVID-19 or the coronavirus in Reidsville, right here, and how it's affecting us all. And that includes businesses and residents, too. We'll be back. We got lots more coming up. Stay with us.